and welcome to Community Pulse. My name is Levi Moore, and I'm one of the rotating co-hosts of Community Pulse. Community Pulse is a public affairs show sponsored by the Hextone Institute of Medicine. And it also sponsors the Foxglove Alliance and a coalition of 15 public healthcare organizations that I coordinate on behalf of Hextone. Just to get a little bit of history, Community Pulse really tries to look at the people, organizations, and issues related to life sciences, public health care, and medicine in Chicago. Today, because, well, the incredible timeless of a lot of stuff, my two guests are actually colleagues, teammates, however you want, how you want to describe it. But I'd like to introduce you to Elizabeth Lundquist, who is one of the co-founders of the iDrop Coalition, and we'll talk more about what iDrop is a little bit later. But actually, right after this, and Garth Reynolds, the executive director of the Illinois Pharmacists Association. So, hey, welcome to Community Pulse.
Thanks for having us.
Okay, well, let's a little background. Garth, who are you? What is the Illinois Pharmacists Association? What do you do? Just to give people a sense.
Sure. As you said, my name is Garth Reynolds. I'm the executive director for the Illinois Pharmacists Association, but I'm also a registered pharmacist. And it's really great to be able to try to help with working out solutions in health policy for patient access. And that's one of the mission statements for the Illinois Pharmacists Association. We've been around since 1880, primarily formed around pharmacy healthcare policy. And initially, the creation of the Illinois Pharmacy Practice Act. But since then, over the last 143 years, we've expanded to try to find ways of advancing patient care and patient access and the role of the pharmacist within that. And we do that by representing aspects of our very variety of practice settings that pharmacists are involved in, from community to health system to long-term care to managed care to academia. And so that's where IPHA helps position pharmacists for success in looking at a new and innovative ways of being able to help patients with medications. And that's where we were really glad to be part of the iDrop Coalition and finding ways of helping support this legislation come to fruition.
Okay, thanks, Garth. Elizabeth, give them the down and dirty, the start, the joy and the tears of iDrop, and who you are.
Okay. So hi, everybody. My name is Elizabeth Lundquist. I am an oncology pharmacist at UW Health Northern Illinois in Rockford. Formerly known as Swedish American Health System. I am one of the co-founders, along with Levi, of the iDrop Coalition. We'll talk a little bit more about, what iDrop is, but I can tell you that, what I do during the day is I prepare and monitor and help manage the care for patients who are on parenteral chemotherapy drugs, so IV, subcutaneous, that kind of thing. I don't really work with oral medications, but only oncology patients and other types of outpatient infusion patients. And but a few years ago, we started having, as oral chemotherapies have become more and more prevalent in the care of cancer patients, we started having more and more patients come in with very expensive oral chemotherapy medications that they were not on anymore for some reason. The medication was usually because the patient had a side effect or the medication was not working. And many of these medications, because they are very expensive and you need to make sure to take them right, are packaged in blister packs and other forms of tamper-evident packaging. And we would have patients come in with this medication that really was perfectly good. And they want to know if they could donate it to another patient in need. And I would have to tell them, no, in the state of Illinois, that is not allowed. I'm very close, so I'm in Rockford, so I'm very close to the Wisconsin border. If we were 50 miles to the north, it would be legal for us to donate, for that patient to donate that medication to a patient in need. So I became very interested in this idea of drug donation and reuse, and ended up deciding that I wanted to get involved in getting a law passed in Illinois to allow for that. And just went randomly searching on the internet for other people in Illinois who were interested in that, and ended up getting connected with Levi. And we ended up forming the iDrop Coalition and getting the Illinois Drug Reuse Opportunity Program Act passed through the General Assembly.
Hey, you know what? Just for out of context for people, one of those blister packs you referenced, how much would that cost
Well,
in terms
many
of
of
value?
many of these oral chemotherapy medications can run easily $12,000 a month. Even some that our patients will be on indefinitely due to their diagnosis can easily run well over $100,000 a year.
So instead of donating them to clinics, we were burning it up, throwing it in the trash, or flushing it down the toilet.
Right. And because of the packaging, there's really a huge environmental impact, because these tend to be, like I said, packaged in blister packs, which makes them, reusable. But it also makes them even more environmentally unfriendly to be putting in an incinerator. And that's the best case scenario. Many medications are not incinerated. They're thrown in the garbage, they're flushed down the toilet, and they end up in our landfills and our groundwater. So, best case scenario, they get put in an incinerator, very expensive, also causes pollution, all the waste that is involved in creating that product to begin with and that packaging to begin with. So, there's such a huge environmental impact to reusing that medication instead of disposing of it.
Yeah, I just, in regards, how was that impacting your members in the past, and then what is opening up?
Well, I
This
think
law being changed?
in addition to, impacting, our members, as much as our patients, as like Elizabeth had already alluded to, a lot of our patients receive a lot of these medications through mail order. And a lot of times, the patients end up with multiple boxes, not just a couple of doses, multiple months and months of medication that, again, gets wasted. And that's one thing that's so great about the solution that we've come up with for a health policy solution, is being able to help redistribute that, and especially try to find a way so that this isn't going into the groundwater. This isn't just going into a landfill or being incinerated, because a lot of times patients they don't know where to go, and either they bring it to a pharmacy at a take back day and put it into the disposal, or they just take it to the pharmacy and go, here, I don't know what to do with it. Can you give it to someone who can use it? And unfortunately, until recently in the Illinois law, there's nothing a pharmacy could do. A pharmacy had to then either take our own expense to waste the medication, or we put it into the collection bins for incineration, because pharmacies just legally did not have an option to be able to do anything else with that medication because of current standards and law. Until the current law change, we weren't able to redistribute that medication, even if there was nothing wrong with it. If it was in sealed packages from the manufacturer, we were not able to do anything until now.
Well, hey, I've told people about, the coalition that got this passed was so broad that once we got started, it was really easy to get. And I'm going to miss some, because there were so many, but help me out. I know there was the Illinois Association of Free and Charitable Clinics, the Illinois Medical Society, the Illinois Chapter of the Crohn's and Colitis Foundation were with us.
Illinois Medical Oncology Society, Illinois Council of Health Systems Pharmacists, the other state pharmacy organization. Yeah, there were many other patient advocacy organizations. Many organizations were really interested and involved. A lot of medical and pharmacy student groups throughout the state. Yeah, and you know what? I just have to. One thing I always think of when we talk about mail order waste is the number of inhalers that some of these people get sent. Some patients get sent through mail order, especially the ones that with the frequency of every 4 to 6 hours. You know, patients will get sent grocery bags, boxes of inhalers, and that product in particular is always packaged in foil in a sealed box, so really tamper evident packaging. And they're really difficult to dispose of because you're talking about canisters. So they're very expensive and very to dispose of, very environmentally unfriendly. And there's a whole lot of inhalers that have been going to waste that I think we're going to be able to redistribute to patients in need through the iDrop program.
Right. And we had an interesting other partner, and I've told people about this, and at first they couldn't figure out why. That one of our members of the coalition was the Illinois Environmental Council, and people would scratch their heads, and it was like, so no, think about it. Their concerns for environmental issues were just as deep as our concerns were about patient care, and they were very helpful. They actually helped us build another group of supporters that really help push across the finish line. And one of the reasons why I definitely want to try to get this show in this month is what happened April 15th, which was National Prescription Drug Take Back Day. So you guys, can you let people know why, what it means, if there's a goal or what?
Yeah, the National Take Back Days are a national program that started out being administered by the DEA. And they're traditionally held in April and in October. And it's ways of pharmacies and law enforcement facilities to be able to work within their communities to help take back a lot of the medications that may be just sitting in your cabinets at home. And then those medications are destroyed. Well, hopefully through the efforts that we're doing with iDrop, that, we'll have less medications going back at take back days, and some of that medication that meets the qualifications coming into the iDrop program. But the take back days are still very important because there's a lot of medications that patients don't need because they've either been discontinued on the therapy, changed to other medications, whatever the situations are, and that needs to be removed from the household for a lot of reasons. One, to decrease confusion, but also to decrease any type of enticement for illicit use. And so, and that's where it's very important. That's where the DEA was really centering on this, was trying to get like unused opioid medications out of the household and get them into disposal. And so that's why law enforcement facilities help out. Now, Illinois, since the creation of the Take Back Days, has created their own Take Back Drug Acts. And last year in particular, Illinois was one of, I believe, maybe the first state to do a statewide initiative of registering or eliciting fees from drug manufacturers to help pay for drug take-back programs in Illinois. And that process is still going through. Illinois EPA is working through that right now. And so we'll see what that looks like, because we've been able to have pharmacies and law enforcement facilities throughout the state be take-back locations and to be ongoing take-back locations. There are many pharmacies that do that as an ongoing program. And some
I think the Cook County Sheriff's Office does pick up like once a month or something like that.
Yes. But we can't say that for all 102 counties. And that's one of the reasons of the initiative of the Take Back Drug Act, was to try to identify and help provide funding for at least one take-back site at every county, at least in the beginning. And that is the first phase of trying to help bring more availability to that. And hopefully, as that program continues to grow, it may offer an opportunity for, part of that programming to be open to identifying medications that don't need to go into the destroy pile, that could go into the eye drop, the redistribution pile.
Yeah, it's kind of tricky, but it's kind of like I guess almost like sorting and recycling. But it's like, no, that should be incinerated.
Right.
No, this is perfectly good to be used. And believe it or not, that little pill, that little vial, whatever, that costs $2,000. That may have even been paid with funds from the Illinois Department of Public Health. You never know. Well, hey, right now we're nearing the end days of the budget session in Springfield. And so before we get near wrapping up, so Garth, Illinois Pharmacists Association, what do you guys have out there this session? What are you trying to build on?
Right now, this session, in addition to, excuse me, first on your question on budgetary asks, we're looking at ways of trying to help continue funding for critical access pharmacies. And that's something that we've been working with the state now for, I guess this is our 5th year, and helping keep some pharmacies to get some monies back in reimbursements from the managed Medicaid portion of the program. Since there's pharmacies in the state that, have a higher percentage of patients who are Medicaid, and trying to help them remain sustainable as we continue to look at longer term solutions. But also,
what is a critical access pharmacy?
A critical access pharmacy in Illinois is a pharmacy that would it would be a pharmacy in primarily counties that are 50,000 or less, but it's primarily, we've also identified pharmacies that are in counties of 50,000 or more that are in medically underinsured areas, and believe me, there are a lot of those areas, even in Cook County, even in the city of Chicago, that qualify as as a medically uninsured area. And
I can think of one called Pembroke Township near Kankakee County that is really, that's it. And I'm from East St. Louis originally, so
right.
and parts of Southern Illinois.
Right. So what we're trying to do is for pharmacies that are in these communities, that if they weren't there, it would make a pharmacy desert. And that's what we're trying to do, is decrease the continuing expansion of pharmacy deserts. And we're hoping that program has had a lot of success over the last almost 5 years now of being able to keep some pharmacies open that normally would have closed if they didn't have this additional support. And so, we're also continuing to look at opportunities of where we can help provide or direct funding for eye drop. And there's still ways that we can continue to look at that. But we're also working on our continued PBM reform for pharmacy benefit manager reform, both for helping out pharmacies, but most importantly, helping out patients. And so we've got a couple of bills this year that are going to help with that. But we're also working with the General Assembly on probably one of the biggest transfers of healthcare policy right now, and that's with the ending of the federal declaration of the public health emergency. Illinois had, in the almost 3 years of the pandemic, issued a lot of state and emergency orders and executive orders around healthcare, affecting all professions, including pharmacy. And there is a major bill package going through right now that's headed to the governor's desk that kind of help codify a lot of those emergency orders and make a lot of it permanent, including a lot of things impacting pharmacists. And so we'll be seeing that come through here in the coming weeks. And the goal is to have that implemented before the May 11th switchover from the federal government. So there's a lot moving on when it comes to healthcare right now in Springfield.
Yeah, Elizabeth, we had an eye drop kind of catch up meeting yesterday evening, and one of the things that popped up was like how Medicaid redetermination is going to change a lot. It's going to, I'm sure it's going to impact you. It's going to impact the free clinics, and just that a lot of ways people are going to really be impacted. So, hey, Elizabeth, I was hoping you could kind of give an update on, excuse me, eye drop. Where we've been touching on it a lot, but just a little bit from what you first said, like where we're at, where we're and what we're trying to do, where we're going.
Okay. So I think just to kind of back up a little bit, I don't think we ever actually like explained exactly what, eye drop is. But the eye drop law actually allows for patients to donate drugs that are unexpired, in tamper evident packaging, that aren't controlled substances, and there are some specific requirements for refrigerated drugs, and allow patients to donate those to any pharmacy or any clinic that is legally able to possess drugs and is willing to accept that donation, and then allow for the medical staff in that clinic, pharmacists, to redispense those medications to patients in need. So that's kind of what eye drop is. There's a lot of, the bill is very flexible to allow that idea, that concept, to be used in a variety of ways. And it is being used in a variety of ways right now. My clinic is accepting donations of medication. There are a variety of clinics throughout the state who uptake has been a little bit slow because most pharmacies are still have significant staffing shortages. I know my own institution has very significant staffing shortages. And then because you can't there's not a lot of, not really any money to be made here. Clinics and pharmacies can charge a uniform, reasonable fee that only covers their expenses in doing the process. These drugs are not sold; they're just, you can charge a low fee, like $1, $3, something like that, just to cover your overhead. So it's been a little bit slow getting pharmacies to participate, but there are participating pharmacies. There are pharmacies that are dispensing these donated medications. What we want to do over the next, 6 months, a year, is increase the number of pharmacies that are participating, and spread the word more about the bill, the requirements that are the legal requirements, which are very simple and minimal and easy to follow. And we are also interested in setting up a virtual statewide drug repository, which would be basically a collection of pharmacies and clinics that are accepting donated medication and then redispensing donated medication, getting all of those parties to communicate in an online format, so that they could share that information, or share those medications throughout the state. So if a patient had, if there was somebody down in Cairo who needed a pharmacy that needed a particular medication, and a pharmacy up in Zion had it, they would be able to transfer, they would be able to know that first, and then discussing transferring that medication downstate to where the patient that needs it is. So we're really interested in setting up a virtual inventory like that, where pharmacies across the state can share information about what they have and share that medication between each other. And that is all allowed under the eye drop law.
Well, hey, I knew this was going to happen, that, that this 25 minutes to a half hour is going to go like that. But, we were able to, like, do a victory lap, but that was just the semifinals. we have more work to do. But hey, so I want to wrap this up. I want to do a little explain. Okay.
Levi, before you go into that, I want to hit back real quick on what you brought up on Medicaid redeterminations. I think anytime that we've got a good health forum like this, we really need to encourage those that are in Medicaid to reach out to the department and to any of their caseworker contacts, whether you're traditional Medicaid or in managed Medicaid, because many people who are in Medicaid now have never gone through redetermination and don't know they need to. So if you've if that term is new to you and you're hearing this for the first time, reach out and contact to the department. If you know a friend or family member who uses Illinois Medicaid, make sure and ask them if they've reached out to the department recently, even just update their information, because that will help trigger the process and questioning for redetermination. So please reach out and make sure that we're all doing our part to help make sure that redeterminations happen, because this is a significant part of the population. 1 in 4 Illinoisans is on some version of Medicaid. So we have to do all of our part to make sure that they get re-enrolled pretty much into Medicaid, because we're being asked to by the federal government to go through that process again.
Okay. Oh, thank you for catching that. Well, very important. I think we're going to try to get that message out through iDrop, through other venues, through Fox Club members that really push this message out. So I'm going to wrap up. Elizabeth Lundquist, co-founder of iDrop, Garth Reynolds, member of iDrop, executive director of the Illinois Pharmacists Association. Thank you for being guests on this episode of Community Pulse. My name is Levi Moore, and Community Pulse is presented to you by the Fox Love Alliance. I am the Fox Love Alliance coordinator, and I work for the Hectone Institute of Medicine, that is the sponsor of this show, and Fox Club. But I don't do this alone. We actually have 2 partners that help with help co-host episodes of Community Pulse, and we're all just another team. It's the Hectone Nurses for the Humanities Program and the Healthcare Council of Chicago, which is a Fox Club Alliance member. So we're all just kind of in the other. So that's it. Thank you, CAN TV, not-for-profit services, and we will be on the lookout for the next episode of Community Pulse on CAN TV channel 21, on cantv.org, and on the Fox Global Alliance website. Thank you.